Welcome back. MedSafetyWeek, a global campaign from the 4th to the 10th of November, brings together 104 organizations across 91 countries to promote safer medication use. Namibia is actively participating, emphasizing the importance of safe medication practices nationwide. Now, here to discuss Namibia's role in MedSafetyWeek is Eunicke Heitha, a medicines information and safety pharmacist from the Namibia Medicines Regulatory Council under the section of the Therapeutic Information and Pharmacovigilance Center. Good evening and welcome.
Good evening, Nina. Thank you for
Thank you for being here. To start with, talk to us about the initiatives that the Ministry of Health, of course, will be implementing this week to encourage safe medication practices.
Thank you. So for the week, we really have jam-packed activities, and most of these activities really involve social media awareness, because the hashtag MedSafetyWeek is a campaign that is geared on social media awareness on the safe use of medications. And one of those activities is really just us also being here on the show tonight with you to just educate the public on general use of medication, how to safely use their medication. So for the week, we have daily activities that are lined up. This morning, we were at the National FM. We were also at Kati FM. Tomorrow, we'll be doing the MICT, the government, at the Government Information Center. We'll also be doing an interview at Kaisames, if I'm not mistaken.
That's right.
Kaisames, that's the Damaranama radio station. And then on Wednesday, we also have activities lined up. Thursday, Friday, we will be having a pop-up in one of the malls. I believe it will be Vernil. Still to confirm that by one of the malls, just to disseminate material that will help to encourage the public on how to safely use their medication, how to report medication. And basically one of the things that the ministry also encourages during the hashtag MedSafetyWeek is also just to disseminate educational material that really just inform the public about safe medication use.
Mm-hmm. I've heard you, what you said, and you've also mentioned, of course, social media awareness as part of this campaign, which, you know, brings me to think about the people that are in rural areas where healthcare information is limited and not so easily accessible. So how is the ministry planning on reaching them during this week?
So just to bring you back, the hashtag MedSafetyWeek is just a week campaign, one of the many initiatives that the ministry does throughout the year to encourage the reporting of safe medication use and the reporting of adverse drug reactions, side effects, in quote. And one of the exciting things that we actually do is we work with the community healthcare workers. They're some of the pivotal people that really keep the health system together, because they really know how to communicate with the patients in their local and native languages. So our community healthcare workers are people that are actually disseminated in various parts in the rural areas of the country that really just help reach patients and basically the end user of the medication that really don't get access to, maybe, let me say, a public health facility. They don't have social media. They may not be able to tune in as we're speaking right now, or some of them don't have radios with them at home. They can really just get this information through their community healthcare workers, which are our star and pivotal people that really keep the health system running.
A vast majority of Namibia's population relies on public healthcare. So what strategies are in place to educate, of course, caregivers and patients about the importance of following prescribed medication regimes?
So the strategy is really, like I mentioned earlier, the hashtag MedSafetyWeek is really just a week campaign. Throughout the year, the government, the Ministry of Health, we really try to encourage different campaigns and awarenesses that we carry out, and specifically through the NMRC under the section of the Therapeutic Information and Pharmacovigilance Center where I'm at, we try to host various pharmacovigilance campaigns. And like last year, we had a campaign where we had our community healthcare workers come in and they were educated on medicine side effect. If a patient explains to them that I'm experiencing the side effect, how should they deal with it, how they should report, because we do have yellow forms which you can physically report. So they also disseminate these forms to the various people the public, and then they show them how to report because of those awarenesses and campaigns that we've been conducting, to just show them that, okay, this is how you can help a general person that is out there in their layman's terms. Yes.
On that note, research suggests that medication errors occur 1 out of every 10 medical administrations. So how does the ministry track and analyze these errors to improve patient safety?
Okay, so when it comes to reporting, the reason why we're also here is because there is actually an underreporting, especially when it comes to medication errors, because medication errors can really happen at any stage of the medication being given to the patient. It could be at the prescribing, it could be at the dispensing, it could be at any stage. But unfortunately, sometimes these are not reported. This is because people are afraid. They maybe think that there will be some sort of stigma that, okay, you made this mistake, you're supposed to dispense this medication instead of this one, and now this patient experienced this side effect. And some medication errors actually do lead to the patient receiving the wrong medication, in quote. And some of the things that we really do to mitigate these strategies is to encourage non-punitive reporting. That is to say that we're encouraging transparency, and we're also not going to judge you to say that, okay, you made this mistake, because we're humans, we're bound to err. It really could be an administrative error, and you know, sometimes
so there's
also
not necessarily consequences.
Yes, there aren't any consequences, because we wouldn't know. Like, for example, I'm a pharmacist myself, so there are times where you can dispense a medication because the name sounds alike. And that, if I report that, and then we, through the regulatory authority, make this information known to the general public through our quarterly feedback reports that we give based on, to just give the statistics, what type of medication errors were reported, then the next healthcare worker can know that, oh, I can actually also make this mistake. Right. I can dispense the wrong drug by mistake, but it doesn't mean that you're going to be penalized for it, because we're human, we're bound to err at the end of the day.
Okay. During MedSafety Week, which local organizations will the ministry be partnering with to further the agenda?
So we have quite a few which are in the pharmaceutical and wholesaler sector. One of them, I'm actually wearing the shirt right now. They sponsored us to wear these shirts, and I'm sure you can see on your screens right now, there's a QR code that you can scan to report side effects. So that's actually also on the back of this t-shirt. One of our collaborators or partners came on board and printed us these t-shirts that we can also disseminate to the various healthcare workers in various facilities across the nation, so that, I mean, if they're wearing this shirt and someone sees behind, scan me to report a side effect, then they can do so. And then some of our partners also came on board with printing educational materials that we're disseminating nationwide in our community pharmacies, at the state hospitals, everywhere. Really, it's massive. And also our Wednesday, we're going to have a Battle of the Pharmacy quiz, where we're going to have amazing prizes to be won, but only by pharmacy professionals. Unfortunately, it's not open to the general public, but it's really one of the collaborative strategies that our partners have come on board to say that, look, hey, what can we do to make sure that this campaign is a success, because, you know, collaboration is key at the end of the day.
Awesome. So this quiz involving the pharmacists?
Not pharmacists, it's pharmacy professionals. So the pharmacy world is actually big.
Yes.
It's not only pharmacists. We have PAs, which are called pharmacist assistants, or pharmaceutical technicians. And I also spoke about our community healthcare workers, which all form a pivotal role in the making up of the pharmacy. So it will be the battle of the pharmacy. So it will really test your knowledge on how, because I mean, if you don't know.
Is it knowledge testing on medication or what exactly?
Medication, and especially, I don't want to give away too much, because medication and basically also the side effects. So right. I mean, we do things in the health system. We do things called CPDs, which are continuous professional development. So it will also count, although it will not be a CPD accredited quiz, it's also one of those things that will also help you to continuously professionally develop yourself. So sometimes, I mean, you can forget that Panado probably has the side effect associated to it. So we're going to quiz on such things, but a bit more in depth. Maybe it's your hypertensive drugs that you dispense every day. How well do you actually know your side effects? Because if you don't know it, then you won't be able to associate it when the patient actually comes and say, hey, I'm experiencing this, or this is happening. So 100%. It's just for us to, like, kind of like a refresher, but it will be a bit intense.
All right.
Yes.
You mentioned, of course, that there's a QR code that can be scanned this week if you'd like to report a side effect. But, I mean, after the campaign is done and somebody would still like to do that, how are they able to go about it?
Okay, so the QR code is everywhere. You can scan it any day, anytime, and it will actually feed into our system, which directly feeds to the UMC, which is the Uppsala Monitoring Center at the WHO, one of our biggest collaborative partners when it comes to pharmacovigilance. So you can report any day, anytime. Anybody, even yourself, can report if you're experiencing this side effect. And ultimately, if maybe you can't, you're a bit tech, you're not so tech equipped, you can also send your report to info.tipc@mhss.gov.na, which is info.tipc@mhss.gov.na, or you can send us a WhatsApp with asking us how can I report, or you can send us your report directly to us on WhatsApp, so we enter it into the UMC database. And also, by the way, everything is confidential. You don't need to put your name in when you're sending a report. Nobody's going to know that you experienced this. It's all confidential. All information is treated delicately, and that WhatsApp number that you can send your report to is 0811 46 5406.
Just repeat that, please.
That is 0811 465 5406.
All right, fantastic. Yes. Well, thank you so much for being here this evening and speaking to us. We appreciate your time.
Thank you so much, Nina.
Well, there you have it. It's almost time to say goodbye as well, but not before we bring you some entertainment. We'll be doing that just after this brief break. Do stay with us. You're watching the Daily Roundup with Nina.